At a Senate Health, Education, Labor, and Pensions hearing on July 31st, Senator Hassan asks Dr. Brian Miller, a professor and physician at Johns Hopkins University, about the impact of hidden healthcare facility fees on the public.
One concerning trend that drives up patient costs is the practice of, and something I think Senator Cassidy has already talked about this morning, it's the practice where providers charge patients hundreds of dollars in extra hospital facility fees or room fees at outpatient facilities. For example, one of my constituents had a regular appointment with a urologist. The appointment was covered by my constituent's insurance, but he was then charged an additional and separate $1,000 room fee by the hospital that owned the practice. So he goes and sees his urologist. The visit's covered, but all of a sudden he gets a $1,000 bill. Can you speak about the recent growth in facility fee billing practices and the overall impact on patients when they can't afford their care?
The impact is terrible because patients don't know. So how are you supposed to know that that you're visiting one of the thousands of clinics that has a facility fee and is located more than 250 yards from the hospital and less than 35 miles and was acquired before, I think it's November 2nd, 2015. So there's zero transparency. And so as a patient, when you go and see one of those sites, see a doctor at one of those sites, you essentially are paying 60, 70% more with no added clinical value and no economic knowledge that you are incurring that cost. So it is terrible for patients.
Well, I appreciate the clarity there. Several states have banned facility fees for office visits and telehealth, and Senator Cassidy and I have been working on this issue together, and I hope the whole committee will be engaged in it.
For more clips like this, stay tuned to Congress Clips.